Good morning, I'm Dr. Malik. Today we'll talk about fevers in general because the rainy season is on, the fevers started. So most of the cases we are getting are fevers, and 90% of those fever cases are viral fevers. You need not take any medication for that. So the most common presentations in fever in rainy season, the most common presentations in fever is malaise, that is body pains, and chills, little chills, sneezing, throat pain, upper respiratory tract infections. You know that in upper respiratory tract infections, you may have sneezing, you may have throat pain or irritation. So some amount of malaise, body pains, and chills. These are commonest symptoms. These are very common symptoms in this rainy season which has started. So they don't need any antibiotics. Don't go for antibiotics. Nowadays people are very much used to antibiotics, like they are taking antibiotics liberally. For example, azithromycin, little fever, little throat pain, they start taking azithromycin. Please try to avoid that. Please try to avoid. Don't take antibiotics unnecessarily, because these antibiotics, they destroy your healthy bacteria in the gut. See, you have very healthy and friendly bacteria in the gut, in the intestines, in the small intestine, in the large intestine, in the stomach. You have plenty of bacteria which are very useful, which are being destroyed by these antibiotics. Please don't take antibiotics so liberally. And the other fever is urinary tract infection. Of course, this is not related to the season. It will present with like burning sensation in the urine and fever, little chills. Actually, urinary tract infection, you will have lot of chills. You will have a lot of chills. You may be having severe chills also. So urinary tract infection is not related to this season. This is seasonal, is mainly the upper two: malaise, body pains, chills. Malaise means body pains. Yeah, sneezing, throat pain. These are the things which present in rainy season, particularly this season. Urinary tract infection also, just there will be burning sensation in the urine, there will be fever, there will be body pains, and don't resort to antibiotics immediately. No, there's no need of antibiotics, at least for a couple of days. For 2 days, please take only something like paracetamol. Paracetamol, that is Dolo 650 or paracetamol 500. You can take 2 tablets at a time, paracetamol 500. This will control your body pains, this will control your fever, etc. Everything. And suppose there is sneezing, headache, etc. So you can take Cinerest, that is paracetamol with some caffeine and Evil. Everything will be there in Cinerest. So you can take Cinerest tablet, or you can take some Dolopar or Dart, which has got caffeine Evil with paracetamol, that is pheniramin maleate, paracetamol with caffeine. These combinations you can take. So please don't take antibiotics. That's what I want to say. Citralca syrup, if there is burning sensation in the urine, this citralca syrup is for burning sensation in the urine. You just take 1 glass water, 2 spoons citralca syrup, mix it and drink it. This you can take 4 to 5 times a day or 5 to 6 times a day. So this is how you take citralca syrup for urinary symptoms like burning sensation. Benadryl cough formula, you all know. Benadryl cough formula can be used for cough and sneezing, etc. You can use, but don't take antibiotics space. So at least for a couple of days, if the fever is not troubling you, please wait for a couple of days. 99% of the viral fevers, they come down in a couple of days. Mild fever, throat pain, etc., body pains, malaise, it comes down just in 1 or 2 days. You will be okay. No need of antibiotics. If it goes to the 3rd day, then you may need some blood tests, because dengue is one of the commonest fevers nowadays. So wait up to first 2 days, you can wait. On 3rd day, you can get blood tests. Like CBP, complete blood picture, and dengue test should be done, and complete urine examination, CUE, and malarial parasite, blood test for malarial parasite. See, blood culture is a rare test. Blood culture is not routinely done. It is a rare test, okay? So, mainly complete blood picture, dengue test, complete urine examination, and malarial parasite. See, usually if malarial parasite, if it is negative, don't bother about it. Yeah. If it is viral infection, usually platelets are in all viral infections, not only in dengue, in all viral infections, the platelets are coming down. See, why we do CBP, why you do complete blood picture? In complete blood picture, you will know hemoglobin, you will know white cell count, how many white cells are there, white blood cells are there, how many red blood cells are there, how many platelets are there. This is how we know. See, normally the platelets are 1.5 lakhs to 4.5 lakhs normally, but in viral infections, particularly in dengue fever, it can go up to 50,000. So normal is 1.5 lakhs to 4.5 lakhs, but up to 50,000 you need not worry. Up to 50,000, if it is coming below 1 lakh, it is alarming. Up to 50,000 there is no real life threatening problem, but if it is below 50,000, you have to get admitted in the hospital. You come to the hospital, and we replace platelets once it is below 30,000. Generally we transfuse platelets. We give platelets to the patient when the count is below 30,000. So these are important. So up to 50,000, you need not have that much of worry. In all viral infections, particularly in dengue, the platelets are falling. That is why you must get the blood test on third day. First 2 days, no antibiotics at all. Then the WBC count, the white blood cell count. The white blood cell count is usually 4,000 to 11,000 normally. 4,000 to 11,000 is the white blood cell count normally. So this 4,000 can come down, or the 11,000 you can this white blood cells, if it is very high, like 13, 14, 15,000 like that, definitely you have infection. Or it is less than 4,000, 2,500, 3,000, then also we say that you have infection. Okay, if it is lower, we call leukopenia. So WBC count, white blood cell count, is also important. As the platelets are important, WBC count is also important to say that you have got infection. The thing is, these are the basic investigations. So CBP, complete blood picture. Dengue is very, very important, whether it is positive or not. Dengue antibodies. So dengue test. CUE, complete urine examination, if there is any pus cells or not, whether you have urinary tract infection. Malarial parasite, these tests can be done on third day. On third day, we generally do the investigations. And blood culture is a rare thing. Rarely, if the temperature is very high and there are some criteria, then we do directly the blood culture before starting antibiotic. Once the antibiotic is started, blood culture may not be positive or it is not correct. That's why we do it before starting antibiotic. And so on third day, from third day, after the blood tests are given, you can start one tablet called Mahasef Plus. Antibiotic. This is an antibiotic. So Mahasef Plus is my favorite. That is, it is available in other forms like Cefixime O. It is a combination of Cefixime plus ofloxacin. Mahasef Plus, one tablet in the morning, one tablet in the evening, at least for a period of 3 to 4 days, 3 to 5 days. At 5 days is the usual course. 5 days is the usual course. Tablet Mahasef Plus from third day, morning, evening, for a period of 5 days. So this is a combination of Cefixime 200 with ofloxacin 200 mg. It is available as Cefixime O, and other brands are also there. Anything you can take. So please don't start antibiotic on first and second day only. Don't start any antibiotics on the first 2 days. You wait up to third day. Usually most of the viral fevers, they come down on third day. If the fever is rising, if the fever is not coming down, then you resort to antibiotic like Mahasef Plus, Cefixime with ofloxacin, morning one, evening one, one tablet in the morning, one tablet in the evening for a period of 3 to 5 days, minimum 5 days. Okay, this is how we primarily treat the fevers. Okay, suppose the dengue is positive, then we treat like dengue fever. And urine examination, suppose we do, if the urine examination shows pus cells, then we do pus culture, urine culture, then see which antibiotic is useful. And blood culture is a rare thing, I told you. And according to this, sometimes if the platelets are very low, if the platelets are coming down, we keep an eye on you. And if it is falling below 50,000, we admit the patient. Usually below 1 lakh, 80,000, 70,000, we usually ask the patient to get admitted. And once it is 50,000, definitely you have to get admitted. And once below platelets below 30,000, we have to transfuse platelets. We have to give platelets to you. And if the WBC is very high, suppose if the white blood cell count is very high, for example 11,000, if it becomes 20,000 or 19,000, that means you have a high grade infection, you need admission and IV antibiotics. This is how you generally treat. Don't be in a hurry to start antibiotics. At least for first 2 days, don't use antibiotics. Use something like Dolo, paracetamol, Senarest, Benadryl cough formula. If it is urinary tract, if it is there is burning sensation in the urine, you use Citralka syrup in 1 glass.